Spotlighting Hawaii's leaders.
We want to bring in Governor David Ige.
Good morning, Mr. Mayor.
Lieutenant Governor, good morning. Thanks so much for joining us. Mayor Derek Kawakami.
Thank you so much, Senator, for being here.
Spotlighting the issues.
Where is the virus right now in our community?
How much is this overall going to cost the state?
How are you responding to the community's concerns? Talk about the level of citations that you guys are writing.
Spotlight Hawaii with Yanji Denise and Ryan Kalei Suji on the digital platforms of the Honolulu Star-Advertiser. This episode of Spotlight Hawaii is brought to you by Chaminade University.
Well, good morning, and thanks so much for tuning in here on this Monday morning. Great to see so many of you starting the week with us here in Spotlight Hawaii. I'm Ryan Kalei Suji, joined by Yanji Denise. And Yanji, this morning we head back to the Hawaii State Capitol.
That's right. We are lucky again to be joined by Governor David Ige live from his office there. Governor, you made some big announcements on Friday, so we want to follow up on some of the changes that the community can expect to see. One of the things that stuck out was Hilton Rathel saying that hospitalization should no longer be considered part of the metric. What are you looking at now if that's not the key indicator?
Well, I would just want to clarify that, Yanji. You know, I think we will always be looking at hospitalizations and the ICU capacities to make decisions. I think we were all just feeling a lot better last week. There's been tremendous improvement in the hospital situation. The COVID cases are down by more than 2/3, more than 60% reduction. COVID patients in hospitals were down by about more than 2/3. And the number in the ICU units all around the state was significantly down as well. So, we still have more than 600 healthcare workers here from the mainland who are supporting our facilities. And so I think it will always be part of the metrics, but there has been significant improvement, especially in last 2 weeks. It's a tremendous reduction in COVID cases and in COVID patients in the hospitals.
With that announcement on Friday, you laid out a timeline for different types of restrictions being lifted and different accommodations based on different groups and different activities that could resume or expand in some way. When do you think further adjustments will be made? Because there is, of course, for example, some of the seating capacity limits that are still set. When do you foresee some of those restrictions being lifted?
Ryan, we'll be following the changes in 2-week increments. So we'll be looking at, what happens after we have fans back at football games and volleyball games, and thank goodness for the schedule. As you know, they are home, then they're away, and then they're home. So it's actually 2 weeks between those kinds of events. And, we're working with the university so we can be monitoring what's happening and be aware. They are definitely really organized up at the university. They have reserved seating, which gives us the ability to see what's happening in all of those events, and that really is helpful. I just want to remind everyone that we still have 430,000 individuals who are not fully vaccinated yet, and 207,000 of those are children. And so we have to be mindful of that. We have to do the things we know that work. It's about wearing masks and get vaccinated for those who are eligible but have not yet been vaccinated. And I think that will help us all get back to normal.
On Friday, the discussion was really centered on Oahu, and you said that you've been making some announcements for Neighbor Island restriction changes in the coming days. What can we expect for that?
Yanji, one of the differences that we have in place is that Neighbor Islands have been a lot more aggressive about implementing restrictions and enforcing them. And so, they have been able to continue with weddings on an outdoor basis. And so they are slightly ahead in the sense that those kinds of activities were not shut down. And so we continue to meet with the mayors a couple times a week to really think through the next phase about how we can in a smart way, look at dropping restrictions and don't end up, endangering or inflaming that spike that really is what we're all trying to avoid.
Dave has an interesting question here I want to bring in. Please ask when I and others who are in the children's event businesses can do parties again like weddings can. These restrictions are really hurting us. One of the things that was mentioned in your press conference on Friday was the restrictions of those who want to attend these events have to be vaccinated, and thus children aren't considered in that category. When do you think, to answer Dave's question about maybe children-specific events or allowing children to be a part of other events with the vaccination not being made available to them?
Well, I do think, and I want to emphasize, Ryan, that we do expect in the next 2 weeks the CDC and the FDA to look specifically at children's vaccines. We know that the Pfizer application for emergency use authorization for children 5 to 11 will be evaluated on October 26th. So we do expect a decision about that, and that will have a tremendous change. And I think that would probably happen sooner than anything else that we could do to look at events with children.
I want to follow up on his question a little bit too, in that once those 5 to 11-year-olds are approved, what do you expect that rollout to look like? Do you think that they'll have vaccination clinics in schools? Do you expect, how do we expect to make sure that all those kids have access to the vaccine in time?
Yanji, I think that's a great question, and we do know, and I have 3 children, and I know that I went through my pediatrician to get a vaccination. So we're working really hard with the pediatricians all across the state to make sure that they're prepared, that they can answer the questions that many parents will have. And so we're working to get as many pediatricians to be able to offer vaccinations in their offices. That's the primary focus. We continue to plan vaccination clinics in schools because we do know that that's the next phase that would allow us to reach more people. One of the real big challenges at this point is, as you are aware, the Pfizer vaccine does require ultra cold storage, and it just gets to be a lot more complicated to have events at every single school, for example. But we're kind of working through that, trying to think about operationally what would make the most sense about how many students results in too few of those getting vaccinated to really put at risk us spoiling too many vaccines. And what are the sizes of vaccination clinics that would make the most sense? So stay tuned. We have the template from the flu vaccinations that we've done in many schools for many years in the past. And we're working off of those templates. So, we do believe working through the pediatricians and then looking at how to organize school vaccine clinics would probably be the major emphasis.
Yeah, Ryan, if I could just follow on that. I mean, to put it in the pediatrician's office, just, I have a 2 and a 5-year-old. So we just did our flu shots, and, it becomes this whole sort of logistical thing for parents to get the kids when they're not in school. If they happen to be in school, get them down to the office. And then how are you going to do that? If you do have the vaccine clinics at schools, will you then have the parents have to come to the schools to be part of that vaccination process? I know we did these large vaccination clinics when we rolled out the initial COVID vaccines, but there we were dealing with all adults. When you deal with children, it becomes a lot more cumbersome.
Yeah, Yanji, that's why, we know that having school clinics, especially for the younger children, is going to be really difficult. I mean, I think that we recognize that, especially if the parents are not there or not available to be with their children when they get vaccinated. And so, that's one of the challenges with the younger children. They all have to get permission to be vaccinated. And then in many instances, parents want to be there when their child gets vaccinated as well. So that's just one of the real big complications with the children's vaccine.
And as it becomes more readily available for children, do you foresee providing a testing option for children as well for those parents who maybe are not as comfortable with maybe giving them or having their child take the vaccine, but wanting to include them in other family activities or taking them to events? Do you believe that a testing option could maybe be available for children as well?
Ryan, right now that will be an option just like it is now for the older children. One of the things that was pointed out to me, I get a lot of calls from the general public, is that if your child is not vaccinated and they are exposed because of a classmate who got COVID or because they went to an event, they will be out of school for 10 days in isolation versus if they're vaccinated, they can get tested and return if they are not symptomatic. So that will be a big difference, I think, when parents think about what is in their children's best interest. And just want to remind people that hundreds of millions of people have been vaccinated, and the vaccines are safe and effective.
I want to switch gears for a second and talk a little bit about tourism. On this program back in August, you had asked tourists to stay away for a time. Are you telling people that they should still stay away, or is it time to welcome the visitors back?
Yanji, we are working on that, the timing and the message right now. I've been working with the Hawaii Tourism Authority, and we've been working with the visitor industry to think through that. Last week, they reminded me that it's not an instant on and off kind of situation. It does take them time to rehire people back. And we do want to make sure that when we invite people back, that we have space and we have restaurants and other activities for them to do. So we will be working through this week to really look at how and when we would be doing that. As we see the trend continue and we are seeing lower and lower case counts, we definitely will be inviting tourists back, and it's just a matter of how we would do that.
We had some hospitality leaders on the show last week, and one of the concerns that they expressed was not only just reopening it and making it known that Hawaii is open for visitors, but also to some of those larger events. Some of the marathons, the Sony Open, some of these key marquee events that help to bring a lot of money into the state. Is your administration or the departments that work specifically with those types of groups, are they working hard to secure that? And what can you say about the availability, I guess, of the state to be able to welcome some of these larger events once again?
Yeah, Ryan, we definitely are looking at it. As you know, last Friday, we announced that the Honolulu Marathon would be going on with limited capacity. We will be evaluating that as we go along, as the case counts fall and we get more people vaccinated. We'll be evaluating that. We do know that the Honolulu Marathon is just a huge event typically. Don't know if we'll get to 20,000 participants like we've had in the past, but we're starting at 500 and then thinking through what that would mean. As you are aware, for those who travel from Japan, they would be vaccinated, fully vaccinated, and they would be tested as the CDC and the State Department is requiring that for international travel. So that changes the dynamic a little, and we'll be looking at all of those factors and trying to make decisions about how big an event we can have.
When we had you on before, you said that you were sort of watching and waiting to see how the Safe Access Oahu program and how the Safer Outside program on Maui, how those would be playing out. What's your view of how those programs have worked? And is that something that you think the state should adopt statewide so that there isn't this sort of county by county hodgepodge where there are different rules for every county, but rather have one state system?
We continue to talk about that with the mayors, Yunji, and in this case, some were concerned, as you are aware, a lot in the restaurant industry was very fearful of a mandate for workers to be vaccinated or tested, and certainly requiring customers to do the same. I had talked to a small business person, and they were really, really enthusiastic about requiring vaccinations, even though they weren't required to do that. They sent an email out to their normal customer base, and they were surprised at the pushback from many of their longtime customers about the vaccination requirement. So, we are monitoring the situation. We did see a reduction in COVID cases in restaurant facilities in the last 2 weeks, and so it is promising. We're thinking about how to relax the restrictions on restaurants. We do know that the current situation is very tough for them to continue to operate, and we know that we need to find a better way for them to increase their business in a safe and healthy way.
And what are you seeing with the vaccination rates right now? We know that there was a significant increase during that Delta surge, but as things have calmed down, as the state has gotten more people vaccinated, are you still seeing a large influx of individuals who are choosing to make that decision to get vaccinated, or have things considerably slowed down?
Ryan, we're still seeing about 30,000 per week now, which is, how it did increase significantly. As you may recall, about a month, 6 weeks ago, vaccination rates had fallen to about 12,000 per week. So we are now vaccinating about 30,000 a week, and it has been pretty steady. I think as businesses have required vaccinations, as you know, President Biden required it for all federal workers and contractors. They announced all employers with 100 employees or more will be required to have employees vaccinated or tested on a regular basis. I think all of those actions have increased the vaccination rate, and we've held steady. I do think that the children would increase that as well. And as you are aware, the boosters for those eligible for Pfizer only have boosted those who got the Pfizer vaccine in getting vaccinated as well.
There's a question here from Miguel. Says, what are the measures for this holiday season, especially for the tourist? I actually want to expand that out and say, also for the rest of us. As we start to plan, Halloween is the first one up, but Thanksgiving is just around the corner, and then Christmas after that. What is your advice? Because people are starting to make their holiday decisions now. How should we look at this holiday season?
Well, just a couple things, Yanji. We do know that travel does increase the risk of getting infected, and especially as we see surges in other states. Hawaii continues, when you look since the very beginning of the pandemic, amongst the lowest infection rates and death rates in the country, and that still continues. So, I would just suggest to people that they should be thinking about that, especially if they were planning to travel to somewhere, to really check out virus activity in those locations. Yanji, we've learned that being outside is safer than indoors. And so certainly I would suggest that people start thinking about what that could mean for their family gatherings. I know that I am. We've canceled family gatherings for two holidays now, and certainly we personally host several of those gatherings, usually indoors, and we are thinking about what that would mean if we could do it outdoors. And then, finally, one of the things about COVID is about minimizing risk, and unfortunately, gathering with people that you don't know the vaccination status, or whether they are symptomatic, is one of the high risk activities. And then drinking and eating just exacerbates that in close proximity. So I think we should be talking about whether people are vaccinated, especially friends and family that you might be inviting to your holiday festivities. And I do think that that will be part of this next holiday season. But I'm really hopeful that we will be able to have holiday gatherings. And I think that it won't be as restrictive as it was last year for sure. But certainly, I do think that the virus activity is on a good trend. I think we've all gotten better about wearing masks and about knowing the things that can put ourselves and our friends and family at jeopardy. And I'm hopeful that we will have Thanksgiving gatherings and we will have Christmas gatherings with our friends and family, especially.
When we talk about the future and what living with COVID looks like, no doubt booster shots are going to be involved in that conversation of how we manage this moving forward, looking into possibly next year and maybe even into the end of next year as these studies continue to come out about booster shots. Is that going to be the next wave of requirements that you think will have to be implemented into allowing people into, say, sporting events or into other venues, and maybe if they only had the initial 2 shots, that they won't be allowed, that third shot is going to be needed? How do you manage, how do you see the state managing booster shots moving forward?
Well, a couple of things, Ryan. I do think that the state is better prepared than most states. The work that we've done with Safe Travels and the Smart Health Card really does allow us to create a process to verify vaccination status, at least within the state. And because we followed the national standard, the National Smart Health Card standard, residents here who are vaccinated would also be able to prove their vaccination if they travel to those states. California and New York are some of the largest that follow the national smart health standards. So I do think that that is helpful. Ryan, when I speak with physicians and public health officials, they really anticipate that COVID will become like another disease like the flu, where they do anticipate that there would be boosters or vaccinations that would be recommended to people. We are getting better, and it's fortunate that the COVID vaccines are a lot more effective and efficient for COVID than the flu. And so, if you get a COVID vaccine, you are really very well protected against serious disease and illness. And I think that that's what we all look for in a vaccine.
We've talked about this before, and I know it's changed under Delta. Initially, we had set out a goal of a 70% community vaccination rates, those 2 shots. We are, if not there already, very close. But what is the new sort of goal? Is it 100%, or is there no percentage that would lead to lifting restrictions?
Yeah, Yanji, there is no percentage that would lead to blanket release of restrictions. We do know that as we speak today, 430,000 of our residents are not vaccinated or not completely protected. And we need to continue to work to get more people vaccinated. I think that that's something that will continue at least for the next several months. I'm glad that many in our community have chosen to get vaccinated. The unvaccinated is just over 100,000 now, and it represents about just under 9% of our community that are eligible but have chosen not to get vaccinated. So, I am hopeful that as people realize that it's safe and effective, and they get tired of getting tested every week or sometimes multiple times a week, that more people will choose to get vaccinated.
one of the things that you also have to consider during this time as the leader of the state is not only the physical well-being of the state, but just the economic side of this, of what COVID-19 has done to the state, and trying to be able to balance the budget to continue to find means and ways for the state to be fiscally responsible and be able to manage all the programs and services that the state does provide. Looking forward, as you look into 2022, as you prepare your budget, how are things looking on the economic standpoint, and how do you think moving forward the state is going to be able to rebound by some of the impacts that COVID-19 has had, and knowing that the federal support may not be as available as it was in the last past year?
Ryan, from a financial standpoint, we are actually well ahead of schedule of what we had anticipated the rebound would look like. As you might recall, in 2019, we had a banner record year for visitor arrivals here. We crossed 10 million visitors, and then COVID hit, and in 2020, visitor arrivals dropped to 2 million or so, 2.5, 3 million, and it was the worst year on record. Right now we're coming up on the anniversary of Safe Travels. October 15th, if you recall, last year was when we launched Safe Travels, and we will have welcomed more than 7 million visitors in the year since we initiated Safe Travels. And if anyone had thought that we would get 7 million visitors in a year, this time last year, I think no one had predicted that. So I think, Brian, we are definitely, I'm aware that many businesses are still struggling. Being able to hire back people and find employees has been a challenge, but we are ahead of schedule. I do think that one big question mark is international travel. And as you are aware, the CDC and State Department announced that they would be allowing for international travel as long as people are fully vaccinated and take a pre-arrival test. And so I'm hopeful. Right now, all of those visitors are mainly from North America. That's those 7 million who have come to the islands for using the Safe Travels program have primarily been from North America. And so I'm hopeful that international travelers will even boost our economy more.
I know that you said that you're still in the planning process of how to roll out the red carpet for tourists, if you will, but when can we expect that announcement?
Probably in the next week or so. I mean, we are working and meeting and talking through that. We continue to see the numbers trending in the right direction. So it really is in the next week or so.
And as we wrap up here this morning, I want to provide you an opportunity just some final comments, and moving forward as we look at some of these new rules and the restrictions that have been lifted that you announced on Friday. What is your final message for those watching here this morning?
Well, I just really want to thank all the people of Hawaii for being willing to sacrifice to help our community be healthier and stronger. I am cautiously optimistic that this trend will continue and we'll be able to relax restrictions and get back to normal. I am hopeful that our holiday season, the Thanksgiving and Christmas, will be significantly better than last year. And, if we can continue to do the things we know that work, wear our masks, maintain physical distance, especially from those who we don't know what their health status might be. And most importantly, encourage those who are not vaccinated to get vaccinated. This holiday season will be much, much better than last. So thanks to everyone.
Let's certainly hope so. That was a tough one last year. We are hoping for better things. Thank you so much for starting your week off with us and for taking so much time this morning. We appreciate you.
Yep.
Thank
Thanks.
you.
Aloha.
Aloha.
Aloha. Well, great to hear from the governor, as always. Some big things that came out of that. Interesting for him to say. I mean, we've talked about this sort of back and forth over time, but for him to say there is no percentage of vaccination that would lead to a blanket lifting of restrictions. So we knew that for some time because Dr. Libby Char has said you'd need probably around 95% of the community to be fully vaccinated before that would be reasonable. So that 70% went out of the window long ago, but I think that's the first time I've heard the governor say, point blank that there is no actual percentage.
Yeah, and that they will continue to use the hospital as a metric and as a point to see how some of those restrictions may be lifted. There was some conversations, as you mentioned on Friday, that Hilton Raythel said that the hospitalizations may not be that factor, that determining factor of those types of restrictions that should be lifted or not. But the governor's saying that that will always be a key indicator of what he will allow and what won't be allowed is the hospital capacity and how what they're seeing there on the front lines. We also heard, as you said at the end of, as we heard at the end of this interview, 7 million visitors still arrived in Hawaii in between the anniversary of this safe access, safe travels, I should say, program that began a year ago on October 13th. So there is a lot of visitors that have obviously still come to Hawaii, and the governor's saying that the state is in a financially good place because of those visitors that helped boost the economy last year.
Yeah, and it felt like they all came this summer all at once. We had such a big rush. Tourism officials, of course, are pushing the governor, tourism leaders pushing the governor to make that announcement and tell visitors that Hawaii is open for business and that they can come for the very busy holiday season. The governor pushing back there, saying it's going to take another week or two, that he's meeting with different parties and trying to figure out what exactly the message should be. So even though there is that pressure from the hospitality industry, he is holding off at least for now.
And we could see further restrictions being lifted over the next 2 weeks. Of course, that big announcement happening on Friday, where they amended some of the restrictions for gathering sizes, for events such as athletic events at the University of Hawaii and weddings. There could be further restrictions that are lifted, but he's saying there should be there will likely be about a 2-week gap between when these initial restrictions are lifted and when any sort of recommendations or new amended rules will come out. So we'll continue to stay posted and watch those numbers and see if in a few weeks any of those changes also are implemented.
Yeah, he's encouraging everyone, of course, to get vaccinated. He said there's about 9% of the population now that's eligible for vaccine. That's not counting those under the age of 12, but just 9% of the community that has not engaged in that first or second dose. He's hoping that the restrictions that are in place and some of the sort of cumbersome things of having to get tested or having to have vaccine verification to get into certain establishment, he says, will eventually just sort of force people's hands. We know that there are some people who are very adamant and don't want to get this vaccine, no matter what it takes. But that 9%, he's really hoping to at least chip away at it in increments so that we get closer to having our community fully vaccinated. We are going to be talking on Wednesday with Mayor Rick Blangiardi. Of course, he was part of that conversation on Friday. So what is he looking at when he's thinking about what should be lifted? Of course, a lot of this does come down to the county decision. So we're really excited to talk to him on Wednesday.
Looking forward to that conversation with the mayor, and encourage all of you to tune back in here on Wednesday and let us know what your thoughts are and your questions for the mayor. We'll see you right back here on Wednesday for another edition of Spotlight Hawaii. Until then, stay safe and aloha.
Aloha.
This episode of Spotlight Hawaii was brought to you by Chaminade University.